Okay, welcome to the Memorizing Pharmacology podcast, and we're going to go over Chapter 4, the Autonomic Nervous System here. So we're in Nursing Pharmacology, the book here, and we are going to do the Autonomic Nervous System. But what we're going to do is we're going to go into the module learning activities, which is 4.16, okay? And this is a little bit different. All of the activities are in one page, okay? Okay, so let's start with question number 1. Okay. The patient begins a nicotine patch in an attempt to stop smoking. Patient reports feelings of nausea and weakness and a rapid heartbeat. What is the likely cause of these symptoms, and what is the nurse's best response? Well, what we're looking for, since we're talking about the autonomic nervous system, is that there's an activation of the sympathetic nervous system. We're going to expect that increased heart rate. We can have weakness and nausea as a possible nicotine overdose. So what we want to do is make sure that the patient isn't using additional nicotine when using the patch, and then removing the patch at bedtime, reapplying the patch in the morning. Question number 2. Patient with benign prostatic hyperplasia, BPH, has a new order for tamsulosin. He asks, how will tamsulosin help me? I already take so many pills. So this is 2 parts. A is, what is the nurse's best response? And B, what does the nurse plan to monitor after administering the first dose? So the first part, A, is just that we're going to relax those muscles in the bladder, and the prostate will allow it to, improve urine flow. We want to kind of think about what kind of drug tamsulosin is. Tamsulosin is an alpha blocker, and alpha blockers will relax the muscles in the bladder and prostate, which kind of brings us to the second part of this, which is, what do we have to monitor, especially after that first dose? A lot of times we have something called first dose syncope, which is a fancy word for fainting. So what we want to watch for is hypotension and tachycardia, because when we have that first dose, sometimes that's an effect that happens. Okay. Number 3, patient with asthma is taking albuterol to help when she feels increased shortness of breath. Part A asks, how will albuterol assist in her breathing? The patient states, after I take albuterol, it feels like my heart is racing. B asks, what is the likely cause of the symptom? And C, what is the nurse's best response to the patient's concern? First, we're going to look at, since we're in the autonomic nervous system, we're going to see, is this beta 1 or beta 2? And albuterol is a beta 2 agonist. So again, it activates those receptors, which happen to be very present in the bronchi smooth muscle. So we're going to get some bronchodilation, which eases that, makes it a little bit easier to breathe. Okay? Now, the whole heart is racing thing is when you give too much albuterol, especially if a patient doesn't uses the rescue inhaler also for chronic symptoms. So again, if a patient is chronic with this, they're probably going to have some kind of steroid that's meant to be given on a daily basis. And if they aren't taking that steroid and just keep using the albuterol, a lot of times it goes from just affecting beta 2 to also affecting beta 1. And if that's the case, then we would get that tachycardia, okay? Which is part B, what is the likely cause of this symptom? And then C, what is the nurse's best response to the patient's concern? Yeah, they may be taking other things that cause tachycardia, like too much coffee, too much caffeine, maybe too much chocolate. But in general, it's going to be that the patient is using too many puffs of albuterol and using it not only for rescue, but also chronically. Question number 4. So a patient with high blood pressure is prescribed propranolol. A, how will propranolol help to lower his blood pressure? B, what will the nurse assess before administering the propranolol? The nurse listens to the patient's lungs a few hours after administering propranolol and notices new wheezing. C, what could be a potential cause of this new finding? D, what is the nurse's next best response? So again, we're kind of going into that beta 1, beta 2, and it's really helpful to remember that we have one heart, beta 1, and that's the receptor that really is present on the heart. And beta 2, we have two lungs. That's where you're going to see beta 2. So the first part is it's a beta blocker, so it's going to reduce that heart rate, but because propranolol is a non-specific beta blocker, or non-selective, it's going to affect beta 1 and beta 2 receptors. So the beta 1 will decrease the heart rate, but the beta 2 will affect the lungs. So part B, what's the first thing to do before administering the propranolol? Well, we want to make sure we know the blood pressure and pulse. Again, tachycardic is above 100 millimeters of mercury. Bradycardic is below 60. And we want to know where the patient is, because what we would be most worried about is bradycardia, a reduction in the blood pressure. Part C, what could be a potential cause of this new finding? The wheezing that the patient is having. So the propranolol, really not a good choice for an asthmatic to use a first-generation beta blocker. That could be causing the bronchoconstriction because it does inhibit those beta 2 receptors, as well as beta 1. So the bronchoconstriction can cause the wheezing. And then D, what is the nurse's next best response? We'll really want to know what kind of, we want to have some data, and that data comes from checking the airway, respiratory rate, how they're oxygenating. And then we want to go and see, okay, well, is this asthma? Is this COPD? And certainly notifying the prescriber, letting them know, hey, this is the data that I'm getting. Question number 5. Patients prescribed metoprolol to help control his atrial fibrillation and irregular heart rhythm. So A, what will the nurse assess before administering the metoprolol? B, what findings would cause the nurse to call the provider before administering the metoprolol? Upon reassessment the next day, the nurse notices a new finding of edema in the patient's feet and lower legs. C, what could be a potential cause of this new finding? And D, what is the nurse's next best response? So let's just start with A. Before, we're always going to just check with any beta blocker, anything that's going to affect the heart rate. We're going to check the blood pressure and pulse. B, what findings would cause the nurse to call the provider before? Again, we're looking for, is the patient going to be, we're going to, in this case, they're probably not tachycardic, but is it over 100 millimeters of mercury? Is it less than 60? If we are, again, less than 60, bradycardic, we want to check with the provider. But also, if we know the patient, for example, if I'm the patient and my normal heart rate is bradycardic because I'm a runner, that might change things. But again, in general, we're going to watch out for that bradycardia. 60 millimeters of mercury is that really what we're looking at. What could be a potential cause of the new finding? Well, since we have somebody that is in atrial fib and has an irregular heart rhythm, really what we're looking at now is, is the patient, having heart failure that's getting worse. Okay, so the edema, is likely coming from the heart's inability to get that fluid through the body. So when we hear heart failure, it's really more about the heart failing to do its job more than it is that the heart fails to beat. It's just not doing its job as well as we would like. And then D, what is the nurse's next best response? Well, we again want to watch for that worsening heart failure, and how are we going to hear that or know about that? Let's look for weight gain. Let's look for crackles in the lungs. And so, notifying the provider, letting them know, hey, I think that the heart failure is worsening, and this is going to cause a number of issues. And then the last one here, 6, patient with an acute episode of heart failure is admitted and is prescribed dobutamine. Okay, So what are we looking at with dobutamine first of all? Okay, so really we're looking at something that is going to affect beta 1 receptors, increasing the strength of the heart's contractions. So this is a positive inotrope. Okay. How does it improve their situation? Well, if we increase the force of that contraction, speed from the sinoatrial to the atrioventricular node, increase that heart rate, we should increase cardiac output. Okay, so again, cardiac output, the formula is heart rate times stroke volume. And then B, what will you monitor carefully during administration? So again, we're going to monitor heart rate and blood pressure as we've done before, but in this case, we're going to be really careful, maybe EKG, cardiac output, urine output. We want to make sure that the medication is perfusing the kidneys and that the heart failure is improving. Okay. All right, so again, this was chapter 4. The autonomic nervous system, the module learning activities. Email me, TonyThePharmacist@gmail.com, with any comments and anything like that. And then, again, if you want to kind of do a better job of memorizing these medications, knowing that tamsulosin, works on alpha receptors, an alpha antagonist, and that albuterol is beta, and that propranolol is a beta blocker. Those types of things are things you kind of have to memorize before you can really start these things. And I think the Memorizing Pharmacology books, in this case, the Memorizing Pharmacology mnemonic book especially, would be really helpful. There's a grid on alphas and betas to kind of keep it straight in your head. Okay, next week we will move on to the respiratory system, and we will work on cases and critical thinking for those questions.